Hello, family. How are you? Thank you for making us a part of your day. That's right. It's time for Senior Talk with Clara Hubbard, your resource and information show for people getting better with age. Well, I have a phenomenal woman, and when you talk about timing, is everything. I've known this beautiful woman for quite a while. We've met in passing through some great friends, but let me tell you, she is the executive director of Project Patient Care. Everyone listening, this is going to be impactful for you as you are living right now. So tell your friends Senior Talk is live on Facebook. We're also live on Senior Talk Media on YouTube and on Twitter. Whew, we've covered all our grounds. But joining us today is my good friend, Miss Pat Merriweather. How you pronounce the last name?
Argus.
Argus. So everyone stay tuned. We're going to get our opening out the way, and we'll be right back with our special guest. All right, everyone. Welcome. I am very excited for this broadcast. I will tell you, I had the pleasure of meeting Miss Pat, as I call her. She says Pat Merriweather Argus. And let me tell you, hello in advance to our good friend, Mr. Keith Cross. We met years ago at one of the beautiful meetings that we were in the Highlands parks of in the Highland areas in South Shore. But Pat, what have you been doing since the last time we've met? You've made some changes, but you're with this great organization, which we're going to dive into a little bit later. What have you been doing lately over the years?
I think over the years, I worked for so long working with hospitals and healthcare providers and working even with the federal government on Medicare. And what struck me is the voice of the patient was never there. And so that brought about Project Patient Care.
Mm-hmm.
And it's really to bring the voice of the patient, the family, the resident, the caregiver to the forefront in policy discussions, in healthcare discussions, and just really making their voice the important voice in the room.
Yeah, that's a beautiful statement. Now, let me say this. That's a big one because, in our healthcare system, there are a lot of people who make decisions, and it would be very advisable for those who are to receive the service would be a part of the process. So being a part of Project Patient Care with your skill level from many backgrounds, how did you become a part of it? And how did you become a part of this network?
I just felt that there was the voice missing. We work at quality improvement. We work on medication management, all these things. And yet it's the patient that's saying, wait, this isn't working for me. Or I see you not washing your hands. Things like that, that I was like, we've got to make them as equal as everyone else in the room.
So there's I went on the YouTube channel, very great content for Project Patient Care. And so what is the umbrella? Let's talk about the umbrella, and then we're going to break Project Patient Care and then break down the umbrella of services. And then we'll get more into the medicine part, which is one. I've been reading you. You got a great thing there. But let's talk about the umbrella of Project Patient Care.
We work in many different areas. For example, we work on safety protocols, safety measures, working with patients, learning from errors. That's one thing, when we talk about the airlines, they learn from their errors.
Mm-hmm.
We keep our errors quiet. And so this is a way of opening it up. And how I got involved, quite honestly, is my father died of a medical error. And so he was a leukemia patient. They forgot to take a simple coagulation test, and they did an invasive procedure, and he bled to death. So the errors that occur, it's harm not only to the patient and the family, but also to the caregivers,
Hmm.
because they are as devastated as anyone else in terms of the loss of a patient through an error, through
Yeah,
an oversight.
absolutely. So, is there something that we as patients, or i.e., our family members, as you were in with your father and his well being, how do we be more observant in those situations?
I think being observant, and sometimes your gut just tells you
Right.
what's going on,
Hmm.
and having that voice. The voice, there's been many programs that, speak out, speak up, don't be afraid. And most healthcare providers will listen, but oftentimes they're not giving you the opportunity or inviting you to speak up. So I do think it's being observant. It's also, simple things like hand washing. Every time they come into the room, every time they do something, they're giving you medication. Well, what's this medication? What's it for?
Hmm.
Everything along the way, having that communicated to why you're getting it and what it is supposed to do and how it's supposed to make you feel. But asking the questions.
Let me say this. I'm about to jump out of my seat because the smallest action is the most preventive, and that is washing our hands. OMG. Just because things travel and
Mhm.
people are still, we're still in this post COVID situation. Should it ever go away? We don't know. But still people are taking the advantage to a disadvantage. Yes, we're being exposed, we're going out, we're celebrating, but we still need to wash our hands. There are so many outdoor gatherings and door handles in bathrooms and restaurants, and just so many things, grabbing mustard for my hot dog behind somebody. This is something that is so serious. The minimal can mean the most if we did that one thing. Isn't that interesting?
It is. It's very interesting. And in healthcare, it can mean life or death.
Yes.
And during the pandemic, the federal government has reported that there's been an increase in hospital acquired infections. So we know we can do better.
Wow.
And it's hard because remember, sometimes during COVID, family members were not there.
Yeah, exactly.
So that voice was missing and that
Hmm.
reminder was missing. So, yeah, I do think that all of us can practice better hygiene and washing our hands. And,
Yeah.
it's our children. We make our children do it.
Right, right, right.
Yeah,
And
children, grandchildren, yes.
so let's do this. There is something that is totally critical that you're working on now. And I believe if I pull it up, there we go, right now. We,
Yes.
we need your voice. Tell us about the Midwest Senior Care Medicine Network.
This is a network in collaboration with the Patient Centered Outcomes Research Institute. It's a national program. It's funded through the Medicare and Medicaid services in health plans. It's a not for profit. And it identified that medication management, the ability to take medicines carefully and safely, was really not there for most people, most
Mhm.
seniors. And I'll give you some some statistics just to bring it home. 750 people a day are hospitalized. These are seniors for side effects from the medication. Another 42% of adults, older adults, seniors, take 5 or more prescription medications. So that's almost half of the seniors. And then when you get to 20%, take 10 medications daily or 10 or more medications daily. So you can imagine the opportunity for sometimes people not feeling well after taking a medication, and sometimes they're afraid to contact the doctor, or sometimes somebody doesn't listen to them. Sometimes you're taking multiple medications and they can be working against you. I'll give you an example,
Yeah.
and I have permission to convey this.
Okay.
My husband has a cardiac condition, and he had COVID. This is about maybe a month and a half ago. And he called his doctor because I insisted on it and said, I'd like to get that antiviral medication. And the doctor said, yes, I want to give it to you, but I also know that there's a complication with your medication, your cardiac medication. So let me reduce some of the cardiac medication and you can take this safely, the Paxlovid. So then I had a friend that had developed COVID as well, and he's in his 80s. And he said, I want to take the Paxlovid. So he has a cardiac condition. Doctor never said anything about the comorbidities or complications. And so he goes to the pharmacy, and the pharmacy has his record on hand and said, oh, no, we can't do this. This will be complicated. We need to call your physician and alert them that this has to be adjusted.
Wow.
So you sometimes catch it through your physician, you sometimes catch it through your pharmacist. And the idea is that so many people suffer from what they sometimes call polypharmacy, multiple medications, and never have the conversation of the physicians that are prescribing, because you could have diabetes, you could have cardiac condition, and sometimes they don't talk to each other. So the medication can be working against you.
Wow. So, okay. So this is totally awesome, because I know of many older Americans or people getting better with age as my seniors, and 750 hospitalized daily.
Yes.
So now I've always understood, now very clear, I'm one who's not on any medication prescribed, thank you. But I'm thinking, if you're receiving the medication from the pharmacy, well, thank God for the pharmacist, for your friend who had the knowledge and they had a relationship. Hello?
Yes.
There's a relationship as well on record. So that's a good thing. But what about those persons who maybe just going to pick up a prescription, and are the pharmacists required to say, are you knowledgeable of this medication?
Yes, they are. They are required, and they're required to respond to any questions you have. And what was so important, and this goes back maybe about 3 or 4 years ago, is many of the pharmacies, the state of Illinois conducted a study and randomly, and with, I think it was the Chicago Tribune, went into pharmacies all across the state and tested to see if they would pick up on the complications of medications that, interfere with each other, as well as explain the medications. And they performed poorly. And so the state instituted requirements of pharmacies. So if you're in Illinois, you've got a good chance that, you ask a question or you raise an issue, and when they say, do you understand the medication? Say no.
Yeah.
And make them explain to you about it. And certainly if you're taking any medications or even over-the-counter medications where it's not prescribed,
Sure.
It's important to communicate that to the pharmacy. They're there to help. And they actually are the ones that really are pushing this initiative, this Midwest Medicine Network, because they want to know why seniors are having so many complications.
Sure.
Or what can be done to help reduce the hospitalizations.
That's a good thing. So here's our question, Pat, or my question. Why are certain seniors still afraid to speak up, knowing this is valuable to their health? I know many who have the little daily tablet boxes, and some things are different now, i.e. we're still dealing with COVID. Some things are new. Our disparities are still here. So why are we so afraid to speak up, knowing this is a huge advantage and this is for us?
I think there's sometimes people, depending upon the age and the era you grew up in,
Mhm.
you never questioned your physician. You never questioned anyone in healthcare. And so it's trying to get over that, which is why family members and caregivers are really important as well.
Yeah.
And then there's also, sometimes, again, does race play a barrier too? People are
Yeah.
sometimes afraid to. And so I ask that question. They don't want to be talked down to. They want to be an equal in the
Yeah.
conversation. So I think there's a variety of reasons. And then sometimes if it's the patient sometimes doesn't feel well. And so if there's a caregiver or family member or somebody that's with them, sometimes they can ask the questions and get and probe the answers.
Right. Okay. So I'm hearing a lot of great things. Tell us how the process. Okay. Let's say if I knew a family member or I have, because you're actually, Project Patient Care is on our speakers bureau, because let me tell you, we have so many senior communities who are still engaging through Zooms and all that. So
Mhm.
definitely, if you want to get Project Patient Care on, contact the Senior Talk office, and I'll put that number out because we need you.
Okay.
This is a big to do. This is not just a he and she problem. This is a her and his, and it's a family issue as well.
Mhm.
So let me ask you this: what is the process of someone becoming to call your agency and say, you know what, I need some help? What is that process like?
We'd love to hear from them, and we'd love to get them involved in this network because we know that sometimes in different communities, there may not be pharmacies available. There
Mm-hmm.
may not be a pharmacist that's communicating effectively with them. We want to know so that we can help the seniors along. So the process is contact us. We have a form to fill out. And then also, what is the best time? Because we want to form groups. Sometimes it's easier when you have more than one person complaining.
Yeah, yeah.
It's that raising of the community. And so after you complete what's called a needs assessment, and for every meeting that we hold, and we'll do it virtually or even in person, there is a $25 gift card that we're giving away with that as well. And you get to select whatever one you want. We're very excited. We know that it's their valuable time they're taking out to spend, a half an hour discussing any barriers or issues that they're having. But we can't get at what are the unique things that people in Chicago experience, and
Mm-hmm.
especially on the south and west sides of Chicago.
Yes.
That's where we really want to affect change. And they're going to be the drivers of the change
Sure.
because we will listen and then we'll go to work.
Right.
We'll go to work in engaging others to correct the areas that are not performing as well as to just make sure we're communicating. And we'll have pharmacists. We have pharmacists from the University of Illinois, the faculty that are very interested and they're participating as well because they're the ones that know. I had somebody come up to me and tell me about all the medications they were on, and I was starstruck by
Yeah.
what I had heard. And then they said to me, I'm stopping all my medications tomorrow. And I said, why? And they said, because they don't make me feel good. And I said,
Wow.
well, we need to get you linked up with a pharmacist that can sort through that and work with your physicians. Because what we support is
Wow.
getting the physician, the patient, and the pharmacist involved, because it's got to be all parties at once and
Mm-hmm.
coming up with a care plan that the patient supports and is part of.
Well, it's really good to hear that it's all inclusive, as they say, all hands on deck. The
Yes.
patient, the physician, as well as the pharmacist. So what are some of the testimonies you can share? I mean, your friend, he is a standalone in itself. As I said, that's because the relationship he had
Mhm.
and his knowledge as well. So what do you say to someone who is thinking, this may be for me, or maybe I need to be more engaged in looking at the prescriptions that I receive and be more open to ask questions?
I think, part of it is you don't want to get into what we call health harm. You don't want
Oh,
harm to come to yourself. But
right.
we also know that people know other people that are dealing with medications, and so they can be their voice. They can be the voice themselves as well as the voice of others. And the testimonials are, they go on and on about, you know, simple things like maybe, I didn't eat for a couple of days. I wasn't feeling well. And so I didn't have, but I continued to take my medication, which if it requires eating, having food with it, it can become toxic. So again, I think
Mm,
there's so many things that we can work through and help patients so that they can have a healthy outcome, because they're projecting that, over the next 10 years with all of this medication, and there's a lot of medication
a
that
lot.
is being distributed, that 150,000 people will die, seniors will die because of medication errors.
Wow.
And they consider medication error all of these things. Like when you tell I had a patient um, tell me that, they said the medication said twice daily. So I took it 2 times at one time. Yes. And again, that's when harm occurs. But making sure that when prescriptions are written, that people understand it.
Yes.
And then if there's the other thing is if they're having problems with the finances of the medications, there's many organizations that can help.
Great
And
point. Great
that's
point.
critical. It
Great
is.
point. Please don't deny yourself your medicine because of cost.
Right.
We'll have a running list for you, or call our offices. Please
Mhm.
not deny yourself. There is help. I know on a previous show there was a gentleman who, and this is valid, he had a diabetes medicine that was well over $300.
Mhm.
We were able to connect him with one of our coordinators, and he's paying $7. There is
Yeah.
help.
And that's what's out there, but it's sort of like, it's the retail price, but
Mhm.
the real price
Yeah,
is really much lower.
right, right.
And even in Illinois reduced the cost of insulin to make
Mhm.
it affordable for everyone. And
Yes.
that's a requirement, doesn't matter what healthcare plan you're on. So I think there's so many things. I have a son that works in an emergency room, and the physicians were and the clinicians were all upset that so many patients kept on coming back for the same thing.
Yeah.
It was because they weren't taking their medication. So they came up with a list, and they give everyone that leaves the emergency room that's getting a medication where they can get it filled, what the cost is. And it's always much less than what you'd get at a hospital pharmacy or
Yeah.
even the retail pharmacy. So yeah.
And
Yeah, there's ways around this.
one of the critical things that you just mentioned too is that the hospitals have a duty.
Mhm.
I mean, if you come back too many times within a 30-day period, that is not a good thing on that hospital.
Right.
But you also have to do your part as
Mhm.
the patient. And if you clearly do not understand, please seek the advice of professionals who can give you the answers. I know even some people, as you mentioned, they won't eat. They'll just take the medicine. Oh, I didn't have an appetite. I'm just going to take my medicine. And that feeling, that's why you're feeling a little
Mhm.
queasy, because you could have had some toast and some fruit or something to help offset it. And I don't know much about medication at all, but I'm just saying you have to do your part as a
Yes.
patient. So what is the best way to become involved? Where are the triggers? So you know what, you need to call
Yes.
projectpatientcare.org, or how do we, what are the triggers you can, or some of the Yeah, triggers. I'm just going to say triggers
Mhm.
that you can give us to say, you know what, let's make that call and get consideration for our loved one or for ourselves.
I think if you're interested in improving the health and outcomes, not only of yourself, but of people in your community, this is a way of helping. And, Chicago's a community where people help each other.
Mm-hmm.
And sometimes the voice of people, because maybe they're not well enough to have that voice, to get involved, to be engaged, to be part of a national initiative to really address the disparities that occur in
Mm.
communities and across the states. And the best way is, we have the phone number at work, but you can call me on my cell. I'll give out my cell.
What?
It's Yes, I take cell calls. 630 5579, and then I'll be able to hook you up with how to complete the information, the background information. It's very simple information, but also what are some of the needs, some of the issues that you've seen either with yourself or a loved one or a neighbor in terms of medication management, because we need the voice. That's what I always say is, I can talk, but we need the voice of the people.
But how do we get them to rally? I just don't want. It's so imperative that this actually is a life saving initiative across the country.
It is.
But how do we get more involved to say yes, I need it? Some of us can be kind of scared at times, and it's not important to be scared. It's more important to be knowledgeable.
It is. It is important. We certainly give out information at all of the meetings in terms of some of the best ways to manage your care
Mhm.
and manage the interaction with your physician, with your pharmacist. But we also feel that it's truly a way that we'll have the voice of people that haven't been heard. Many communities have ready access to pharmacies.
Yeah,
In Chicago, that's not always the case.
very
And
true.
so we want to make sure that that voice is out there. We also know that sometimes the pharmacies come and go, and the pharmacists come and go.
Yeah,
Are there some pharmacists that they can contact and explain and get to know them and get them to get their physicians to be involved in their engagement? So it's really, to me, medication management, it can either make you better or it can make you worse if you're
hmm,
not managing it well. Medications can, as we talked about, can work against you if you're not feeling well, if you're not taking it correctly, if you're not taking it on time, if you can't afford the medication. And again, this pertains not only to everyone listening, but also their family members, their neighbors, their community, their church members. It's all over. It's really the only way. When we have the voice of the patient, that carries.
yes.
When it's me talking, yeah, sometimes they listen, but most of the time not. But for a patient, they will listen.
Well, let me say, I became more knowledgeable. I definitely know that I would be an advocate. I've seen so many people, even having a young family member that has had so much medicine, they just said, I'm confused on what I'm looking at. And this has been over some years, and it's a lot. I mean, medication, and it's to help make you feel better, but you have to do your part as well.
Mhm.
And if you're not knowledgeable of what you're taking, please do not. Get professional assistance. As we mentioned, Pat has given her number, which is a beautiful thing. And that number is 630-202-5579. If you need more information, you're definitely welcome to call the Senior Talk office at 312-428-6919, and we will forward her contact. She is on our Speakers Bureau, Project Patient Care. This is the summer months. We can get out, we can do Zooms, we can do church parties, block club, red hat, pink hat. We can come anywhere, bridge club. We will come to you. But just the knowledge alone and having that tool and someone that can give you more comfort. And we're asking you all, I mean, it's not an easy task to bring your health situation to someone. If you have a caregiver or a family member that you entrust, bring them along as well to be an advocate with you, but learn it together. Learn what is happening. So, Pat, what is your closing remark? You are awesome. I got so many tools. This 750 hospitalized. I got stuck there. But we're going to advocate. And as I mentioned, we're definitely going to bring you back to share more, any updates. And she's available. She can come to your community room.
Yes.
All the Atlas centers and all the senior centers around the city. Call Senior Talk office. Will connect you with Project Patient Care to be at your building, your meetings. It is critical. All right, I got a few coming up for you already that I wrote down. A couple of CAPS officers want you to come speak with them, so we're going to make that connection. That just came through. Sorry about that. But anyway, what's your closing remark, Pat? You were great, and thank you so much for your time and be a part of our show today.
Well, it's always great to be with you, Clara, and all the seniors. And I'm a senior myself, so I enjoy all the shows. And I just, again, this is the opportunity to have the voice. Let's close the gaps that exist. Let's get the pharmacies in the communities. Let's get the pharmacists talking to the patients. And again, let's avoid hospitalizations. Let's avoid death and harm to people, either yourself or a loved one. This is truly, medications can be very good, but if they're given wrong or you're not receptive, your body doesn't receive them well, it can become deadly. So again, we really want to make a difference and an impact. And again, I have to say the voice of the patients is what makes the difference.
Absolutely. So everyone, thank you so much for making us a part of your day. I am Clara Hubbard, host of Senior Talk and your granddaughter in the community. Our special guest today was Pat Merriweather Argus, 630-202-5579. You can also find this podcast coming up on our Amazon Music under Senior Talk Media, iHeart, and Spotify. We've covered it all. So everyone, thank you so much. And please, if you have any further questions, don't forget to call our Senior Talk office because we are here to serve you at 312-428-6919. Make it a great day, and we look forward to serving you in the near future. Take care.
Thank you, Claire.